the most defining challenges are the patients. The patients are the most important thing in the entire ecosystem of what you're trying to accomplish. Many of these patients have been abandoned by doctors because there's nothing for them. So they have, some of the older patients have lost hope. Many of the younger patients are desperate. So the most important challenge that we have is on the two fronts of dealing with the patients. On the one hand, not offering unrealistic hope to those who are desperate, who are just getting this, who are just getting to realize that they are now have a disorder, their child has a disorder which will live with them forever. And on the other hand, recruiting and building the enthusiasm yet again in those who've lived with this disorder for 10, 15, 20 years and no longer think about themselves as having any hope whatsoever. So too much hope, too little hope. I believe that's one of the greatest challenges, unlike cancer patients, where everybody's desperate for a therapy and many people offer them many different things. Here, for the first time, you have patients who've never had any drug, and you cannot and must not and should never offer them unrealistic hope. We have great belief in our drugs, great belief that they can help them, but you must put that in the context of what it can do and is likely to do. That's one problem. The next, I think, is really very important, is recognition of these disorders. These are lost families. There's 1 million of them out there. With that 1 million people out there, each one of them has lived alone, whether they be in Kansas, whether they be in Alabama, whether they be in Alaska. They are rare, and as a consequence of being rare, they're alone. There are very few physicians who actually know them. So getting to them, having them have the pride, the collective will to actually want to be treated, to bring them together in sufficient numbers to run the appropriate clinical trials, tremendously important and very difficult. And it's a skill that Ovid has built for the areas we're in. And it's a skill that we will continue to build in all the other areas. But what's important about that is there's not a lot that once you have worked out in one disease area that you can't then replicate in another. So rare diseases of the brain, these are very rare. There's about, as I say, 100 of them and 1 million patients. Once you understand one disease, the not-for-profit organizations, the physicians, the social media content, the types of researchers that are working on it, it's extremely efficient and straightforward for Ovid, which is what we focus on doing, to then move to the next disease and the next. And that's exactly what we've done. We've gone from neurodevelopmental disorders. We've understood that they have epilepsy. We've not tried to look at that. We know there are good treatments for that. But we've identified in that the rare epilepsies that are all over the place. There are many of them. There are 9 specifically which fall under the umbrella of epileptic encephalopathies. But we understand them because they have the same social content, the same wraparound, the same regulatory approaches that are required, the same payer approaches that are required, the same physicians that are required that you see in neurodevelopment. So in a very small company like Ovid, we can go from one area, learn about it, move to help patients in the other.